So, a pleasant day, dear doctors, and welcome to our session, which is going to focus on biochemistry, particularly the pentose phosphate pathway, or what we call the hexose monophosphate shunt. Now, the official reference, which I will be using, is Harper's Illustrated Biochemistry. I'm using the 31st edition for this session, and this is from chapter 20, which is the pentose phosphate pathway and other pathways of hexose metabolism. Now, about 90% of the content of this module is lifted from this chapter, and the clinical aspects are lifted from your pediatrics and your pathology books. Okay, so let's begin. So, the functions of NADPH. We keep on mentioning NADPH. What actually is the function of NADPH? Number one is for the biosynthesis of fatty acids as well as steroids. Okay, fatty acids and steroids. Next function of NADPH is to maintain the supply of reduced glutathione. This is not the same glutathione we're referring to, which is for skin whitening. We're talking about the glutathione, which helps battle oxidative stress and protects the cells, particularly the RBC, against reactive oxygen species, or the ROS. Next function of NADPH is it helps facilitate the bactericidal activity, of the polymorphonuclears or the neutrophils. That is why patients with the deficiency of NADPH would have recurrent pyogenic infections. The other function of NADPH is to supply the liver with the microsomal cytochrome P450 enzymes. Okay, so please take note of this. Okay, the functions of NADPH. And again, what is that very important pathway which produces NADPH? It's the pentose phosphate or the hexose monophosphate shunt. Now, I love this question. This question came out 3 biochem exams ago. So board recall alert. It is lifted from Harper's. They were asking which of the following pathways is the pentose phosphate pathway active? So it's active in the following tissues. Number one, the liver. Number two, the adipose tissue, the adrenal cortex, the thyroid, the erythrocytes. This is the one that most people memorize, the testicles, and the lactating mammary glands. Okay, now always remember the activity of the pentose phosphate pathway is low in number one, in the non-lactating mammary gland and the skeletal muscle. So again, activity is low in the non-lactating mammary gland and the skeletal muscle. So since the pentose phosphate pathway is active in the liver, the adipose, the adrenal cortex, so basically, these are the tissues which actively utilizes NADPH for particularly fatty acid synthesis, steroid synthesis, as well as amino acid synthesis. Okay, and for the erythrocytes, particularly the reduced glutathione. Okay, so please take note of this. Now, I just want to check if everyone understands before we end up with the last slides. If there is one product of the pentose phosphate pathway that I want everyone to bring home with them. What product is that? Look at this slide. What is the biggest here? So this is like one of my major take-home messages. Make sure you memorize NADPH. Okay, and NADPH is consumed for fatty acid synthesis, steroid synthesis, drug metabolism or xenobiotics, and glutathione metabolism. Okay, so please take note of that. Simply lang very visual. You should remember in your hippocampus the biggest text here, which is the NADPH. Now, let's wind up with the clinical pearls. So the pentose phosphate pathway and the enzyme glutathione peroxidase protect the RBC against hemolysis. Now, I want everyone to memorize this. In the RBC, the pentose phosphate pathway is the sole source of NADPH. Please memorize that. So in the red blood cell, the pentose phosphate pathway is the sole source of NADPH for the reduction of oxidized glutathione. So oxidized glutathione needs to be reduced, and the enzyme here is glutathione reductase. This glutathione reductase contains FAD. Now, question, what vitamin is needed for the synthesis of FAD? What vitamin is required for the synthesis of FAD? Okay, very good. It's riboflavin, which is vitamin B2. Now, what catalyzes the removal of hydrogen peroxide? Okay, this is now the glutathione peroxidase. Now, glutathione peroxidase contains selenium. Okay, selenium is an analog of the amino acid cysteine, particularly selenocysteine. Okay, now question, what is considered to be the 21st amino acid? What is the 21st amino acid? Okay, very good. The 21st amino acid, based on its pK value, is selenocysteine. Okay, now question, what fat-soluble vitamin is synergistic with selenium? Okay, it's an antioxidant. Okay, very good. It is alpha tocopherol or vitamin E. Okay, vitamin E. Now, this is lifted from your textbook. Okay, so look at this, the pentose phosphate pathway. This is the NADP. Okay, NADPH. I hope everyone remembers the FAD. Okay, glutathione reductase needs to reduce oxidized glutathione. So this is glutathione here. And to remove the hydrogen peroxide, we need glutathione peroxidase, which also needs selenium. Now, question, what are the three amino acids which comprises glutathione? So what are the three amino acids? Okay, let's type this, which comprises glutathione. Okay, let's see your answers. Okay, so let me revise my question to make it more board-like. What is the amino acid sequence okay, the amino acid sequence. So please remember, glutathione is a tripeptide. Okay, again, glutathione, the amino acid sequence. So this is a tripeptide. Okay, so let's see your answers. Okay, can you spell it out? Okay, the glycine is correct. Very good. Okay, there's cysteine. Very good. And there is glutamic acid. Make sure everyone knows this. So that's the spelling out. If you are to put this in abbreviations, so that's cis, that's gly, okay, and it's glue, cis gly glue, okay. Memorize that. So that is the tripeptide amino acid sequence of glutathione, okay. So hang in there. We should finish in about less than 10 minutes. So this is what came out 2 exams ago. Okay. Glucose 6 phosphate dehydrogenase deficiency. So a deficiency of the rate limiting enzyme glucose 6 phosphate dehydrogenase. Now, in the older editions of Harper's, they discuss this in a paragraph. You can also see this in Robbins. You can also see this in Harrison's. So I'm using arrows here just to make things faster. So let's say there is the lack of glucose 6 phosphate dehydrogenase. This is how simple it is. If there is a genetic deficiency of glucose 6 phosphate dehydrogenase, then simply there is no hexose monophosphate shunt. Is that clear? So I'm going to ask this like no brainer question, okay? Don't be offended. Why is there no hexose monophosphate shunt if there is no G6PD? Because it is the rate limiting enzyme, the first enzyme in the first step of the hexose monophosphate shunt. And what is that product I told everyone to memorize? Okay, it has 5 letters. The product of NAD, oh, sorry, not the product of NADPH. Sorry, I got carried away. The product of the hexose monophosphate. It's NADPH. So this is how it was asked in the exam. Okay, so no G6PD. There's going to be no hexose monophosphate shunt. There's going to be no NADPH. Does everyone follow this? So if there's no NADPH, there is no reduced glutathione. Is that clear? If there is no reduced glutathione, there's going to be accumulation of hydrogen peroxide in the RBC. Therefore, the lifespan of the RBC will be decreased. So it's less than 120 days now. There's going to be increased hemolysis. And this will explain the hemolytic anemia in patients with glucose 6 phosphate dehydrogenase deficiency. Okay, so we mentioned the glutathione reductase earlier. So I want everyone to memorize that. Now, memorize this statement. Okay, take a picture of the slide if you want. Jot it down if you want. So in the RBC, in the erythrocyte, the pathway has a major function preventing hemolysis by providing NADPH to maintain the glutathione levels in the reduced state. It is the reduced state of glutathione, which is the substrate for glutathione peroxidase. Okay, please memorize or at least internalize this statement. Okay, so just hang with me for a couple of more minutes. An hour and a half discussion, basically compared to reading this from the textbook. Some of you will still probably be on page 3 or page 4. Okay. So in the erythrocytes, the pathway has a major function in preventing hemolysis by providing NADPH to maintain glutathione in the reduced state as a substrate for glutathione peroxidase. So, this is a summary of the last part of the chapter. So, the impairment of pentose phosphate pathway leads to erythrocyte hemolysis. So, basically, there's going to be number one there, the glucose 6 phosphate dehydrogenase deficiency. This is more common, Mediterranean and Afro-Caribbean descent. So this is an X-linked disease. Therefore, it's mainly males who are affected. So if there's a mutated gene for glucose 6 phosphate dehydrogenase, most patients, majority, are asymptomatic. However, the most common manifestation, if there is, it's going to be hemolytic anemia. So I hope everyone remembers this is part of our newborn screening. Okay, this is part of our newborn screening, G6PD deficiency. Now, bring this to the boards. Measurement of the RBC levels of glutathione reductase is utilized to assess vitamin B2 nutritional status. So please take note of this. I'd like to add riboflavin or vitamin B2. If there's deficiency, okay, this usually is associated with chalosis. It's also associated with angular stomatitis. Okay, and don't forget the B2. This is needed for FAD. Okay, flavin adenine dinucleotide. So please bring this to the board exams. Okay, now we mentioned already the glucose 6 phosphate dehydrogenase deficiency. This is the major clinical correlate for this pathway. It's X-linked recessive. So basically, ano yung X-linked recessive? Who's affected? It's the males. So it usually presents with hemolytic anemia and sometimes symptoms of chronic granulomatous disease. We will mention in a while the usual manifestations of CGD. So the female heterozygotes of this genetic disease have an increased resistance, okay, to malaria. Okay. Now here, take note of these drugs, particularly for pharma and biochemistry. So there's a handful here, but I want everyone to memorize by heart. Number one on the list is sulfonamides. Okay, trust me on that. Memorize the sulfonamides. Please memorize that. And just memorize the word antimalarials. So sulfonamides and antimalarials are contraindicated in patients with G6PD deficiency. Okay. Doc, I only have 2 brain cells left. I only have 2 neurons left. Then memorize antimalarials, memorize sulfonamides. Okay. Now, in the older editions of Harper's, it mentions favism. Okay, this is how the fava beans look like. So these are the broad beans, which are usually part of the Mediterranean diet. So there is a hemolytic crisis. Okay, a hemolytic crisis that occurs when someone with a deficiency of G6PD eats fava beans. So the manifestations, pallor, hemoglobinuria, jaundice, and severe anemia about 24 to 48 hours after the ingestion of fava beans. So memorize fava beans. Later, when we go to the final coaching and the master class, I will just mention fava beans and I'm going to ask you what enzyme is most likely associated or deficient. You should answer G6PD. Okay, now Summary of the clinical disorders of the Hexose Monophosphate Shunt. We've already memorized and dissected glucose 6 phosphate dehydrogenase deficiency. We've already mentioned the Wernicke-Korsakoff, which we see in alcoholics and is associated with deficient transketolase activity. Okay, so we're going to end up with chronic granulomatous disease, okay, CGD. What enzyme is deficient in CGD? Okay, make me proud. Let's end on a high note. What enzyme is deficient in chronic granulomatous disease? Now, God forbid you tell me that CGD is caused by a prion. Okay, that is CJD, the Creutzfeldt-Jakob disease. Creutzfeldt-Jakob is prion. This is CGD, G as in goat. Okay, so this is caused by a genetic deficiency. You are correct. NADPH oxidase, which we see in the leukocytes or the WBCs. As a result of deficient NADPH oxidase, okay, remember antimicrobial activity in the neutrophils, the polymorphonuclears, you are now prone or susceptible to catalase positive organisms. You are prone to pyogenic infections. Now, how do you test for CGD aside from the absence of this uh, enzyme, NADPH oxidase? This is confirmed by your tetrazolium tests. Okay, there is a negative nitroblue tetrazolium test. So CGD usually presents keywords. Okay, your guru guide, your keywords for CGD. CGD equals recurrent infections plus granulomas. Okay, there's granulomas formation. Okay, so please take note of that.